Hi everyone, welcome back to the channel. I'm Dr. Kavipriya Soma. I'm a practicing general practitioner in Australia. We have discussed in our previous videos as to how to become a doctor or a general practitioner in Australia and what are the pros and cons. So in this video, we are going to talk about which are the potential specialties that have got high earning capacity. Now, this is only approximate. If I am wrong, feel free to correct me, or if I am right, give me a thumbs up in your comments as well. But remember, it does take significant effort to get to that point. So what are some of the factors that influences the earning potential? First things, demand and supply. As you all know, where there is a higher demand and less supply, obviously the earning potential increases. The length of training, so each specialty is different. It can be anywhere between 5 to 6 years to more than that. So the significant time invested in training. Then of course the skill set. So if your skill set is highly specialized into or a very narrow skill set, then that gives you the advantage. Then of course where you practice, public versus private, metro versus remote, all that will influence the earning capacity as well. And yes, location, like I mentioned, metro versus remote. So just to give you an example, years ago when we started working in Tasmania, we had a physician who used to come to the rural clinic in his airplane, and he would land in the town, do his work, go back in the plane. So there is that opportunity if you really like as well. We're going to go in reverse order, who's going to make the most. But remember, it also means, the time frame of work. So if you're only working 1 day a week, then that would change. If you work 5 to 6 days a week, then that would change your earning potential as well. So starting from our countdown of specialties, the first one is, I think, GPs. In general GP, will give you somewhere between 150 to 300,000. But if you do have GPs with special interest, then that can change. Bearing in mind, if you own a practice, that can take a beating because there's lots of expenses that come with owning the practice because all your earnings will go into that expenses. So be mindful of that. So at number 9, we have psychiatry, anywhere between 2 to 400,000 per year. You can work in both public and private setting. Psychiatrists are in demand in Australia, so it's a well sought out profession. Lots of ADHD, ASD that are being currently dealt with, so there is an increasing demand for that. Coming at number 8 is pediatrics. I'm sure you all know what pediatrics means. Anywhere, again, somewhere along the same lines, 200 to 400,000, especially developmental pediatrics, whoever has got special interest, because a lot more kids, the focus is on the milestones and the development, and more kids are being diagnosed with autism spectrum disorders. So there's a need for pediatrics with special interest. At number 7, the profession that can never go out of fashion or in demand is obs and gynae. As long as women are on the earth, obstetricians are needed. That's one thing, you can't deliver a baby by any other way. So the obstetricians and gynecologists who can also make anywhere between 250 to 500,000 a year. Yes, and if there is more surgical procedures are being performed by yourself, then obviously in a private practice setting, then that earnings can go up. Coming at number 6 is anesthetics. The earning potential is very similar. Yes, and they can work similar to other specialties in both private and public. They can have their own lists. So that is also, not only just the anesthesia, they can specialize in pain medicine or specialize in managing only the ICU. Emergency medicine physicians come at number 5, high pressure workload, dealing with acute scenarios in the emergency or trauma. It is quite demanding though. The roster can be quite exhausting and the work per se can be quite demanding as well. But on a positive note, then you do look at the earnings anywhere between 300 to 600,000 dollars a year. Coming at number 4 is radiology, a really very well sought after profession. It's not only necessary to be there in-house to do the reporting, you can also do remote reporting, which is wonderful because you don't have to actually go, but that's an option. Again, the earnings anywhere around the 600,000 mark. Coming at number 3 is orthopedics, almost sitting at about 700,000 per year. So these are people who fix broken bones. So as you know, then that involves a lot of surgical procedures. Again, high demand, but also time, a lot of time has to be invested. At number 2, the most glamorous sort of specialty, cardiology, sitting at about $800,000 a year. And again, if you do interventional cardiology like angioplasties, pacemakers and all those things, then that boosts your income up. At number 1 is a surgical profession. It can be general surgery or just surgeries subspecializing in any part of the body, neurosurgery or cardiothoracic surgery, sitting at 1.2 mils per year. The training is rigorous, but as you can see, the remuneration at the end of it is worth it. So not only just the education, but there are other factors that affect your income beyond your study and specialization. So some of the things that you got to be aware of is the workload. So as your skill set or specialization narrows, then your workload increases. And it's not just medicine that we have to learn business as well. So business acumen is very important. The geographical location, so where people can access you, is very important. So depending on what specialty you choose, then you got to base yourself either metro or remote or rural. So your clientele is built up and your income depends on that. As mentioned in our previous videos, all these things come with its own challenges. So what are the challenges? Importantly, the work-life balance. So it's really, really important. Otherwise, you're going to miss out on important aspects of your life, like becoming a father or mother or being there for your child when they need it. It can tug at your heart. So that's one aspect that can be potential or can become a potential issue. Stress levels. So again, even if you're a doctor, I'm telling you, go do your exercise every day. It's really, really important. Meditation. So doing that, taking care of yourself at a personal level is really important because stress is quite high in any of these professions. And the long training period comes with its own challenges of dealing with the various personalities that are around you, not only colleagues, but patients or clients, nursing colleagues, administrative colleagues, your seniors, your juniors, your colleagues. So there's a lot that you have to deal with. But at the end of the day, if this is something you enjoy, there you go. So if you're choosing medicine purely for money, don't do that. Do it because you're passionate about it and money will come. So if that is who you are, go and conquer medicine. All the best. So if you would like to leave a comment or if you have a question that we can help you with, please feel to comment on this video. We'll try as best to answer as possible.